Hello, everybody. Welcome to my first podcast on YouTube channel under the Ortho Guy. In this video, I like to cover physical therapy approaches to osteoarthritis, which is a very common disease or diagnose. Almost everybody can benefit from this episode or this podcast. So bear with me. I just want to give a brief understanding of what actually osteoarthritis is in order to understand how to treat it. What are the clinical symptoms of osteoarthritis? How do we do our pain managements? As far as physical therapy, what type of approach are we going to take with these patients since their pain level is pretty high and pain tolerance is really patient to patients with osteoarthritis. So just a brief definition of osteoarthritis, it's a degenerative joint disease, which majority of us, once we hit 30 or higher, we're going to start having degenerations. Some people have early osteoarthritis, some people have later osteoarthritis, but at some point in our lives, we will definitely have osteoarthritis. And then osteo means bone, arthritis means inflammation of a joint. So basically, when the joints become inflamed, they're gonna start eating the tissues that are actually between the bones. Majority of the osteoarthritis hits bone bearing joints such as hip, knees, or ankles in majority of the pops or populations.
I'm good, man.
The prevalences of demographics, as I covered it earlier, it's just older adults will definitely have osteoarthritis at some, point of their lives, but because of a lot of diet changes and a lot of high stress in our life, especially after COVID, it's osteoarthritis become more common even in the younger adults. Understanding the symptoms of osteoarthritis will help to design a better plan of care for physical therapy for those patients. Joint pain, stiffness, reduced range of motion, and swelling are the common findings or symptoms of osteoarthritis. When I'm talking about joint pain, I mean the gradual onset of a pain. It gets worse than over time. This is like pure symptoms of osteoarthritis. The pain often gets aggravated by weight bearing, and it gets better when you're resting, meaning when you compress your bone by walking, by doing maybe going up the stairs, utilizing your body, compounding forces, weight bearing forces to your extremities, especially in the lower extremity, will cause pain. But in other hand, when you're actually resting, laying down, it feels better because now you're not really applying any forces to your joints. And going back to osteoarthritis, understanding is that the joint is affected. So every time when there's bone on bone, it's going to be painful for the patients. As far as the stiffness with the patients, patients usually complain of pain in the morning as soon as they wake up, and it gets better as the day goes. This means that if they start using their joint, they start having blood flow throughout the joint, it feels better. So this is another sign that osteoarthritis might be on the table with the patient. Especially if you have a patient with a chronic type of osteoarthritis, these signs are more prominent with those patients. Stiffness after periods of inactivity. If you sit down for too long, if you lay down too long, the muscles get tight and patients start having joint pain. As far as reducing range of motion with those patients, they have difficulty moving their affected joint, such as hip, such as knee, and such as ankle in full range of motion. So understanding that all the joints in our body should have a standard range of motion, meaning they should move to a certain degree to enable us to do physical activities or to be able to get our activity of daily livings done. If those movements become lessened, Among with crunchy sound or kind of like crepitus sound, this is another symptoms or sign of osteoarthritis. This means that the smooth cartilage that is wearing out, that is kind of like smoothing out. And as far as swelling, when there is bone on bone effect in your body, our normal response, physiological response of the body to those bone on bone, it's usually releasing white blood cells to the affected joint, which causes effusion or swelling, which swelling by itself can cause reduction of range of motion and also causing pain. Now you have good understanding of the symptoms of osteoarthritis. You need to understand the clinical presentations and patient's complaint, like what type of pain they're experiencing, what are the ADLs that they have difficulties with. Let me talk details about these two criterias because this is very essential to your plan of care when you design the specific care or plan for the patient. Aching pain, it's usually a sign of a muscle involvement. Dull, achy symptoms that patients tell you during your history taking, it's usually indications of a muscle. It's persistent discomfort in the affected joint. So they're pointing out to their knee, but that dull, achy pain might be initiating from a quad, hamstrings, or calf muscles. A sharp pain, it's an indicator of a joint, meaning there might be a bone on bone with this scenario, with these patients. It's going to be occasional because osteoarthritis has gradual onset, so it just doesn't happen over time. The degeneration happens slowly, therefore the signs and symptoms of it will go slowly. Also, you might experience referred pain with patients, meaning that due to functional limitations, patient starts compensating. Therefore, now there are some other affected areas on the table with you. Impacting of activity of daily livings, as you know, when we get our stuff done throughout the day, we use squatting, lunging, kind of like twisting, bending over mechanics as of everyday activity of daily livings. So it's important to assess that as part of your evaluations with the patients. But patients usually complain of walking, going up the stairs, getting up from the table, getting up from the seated position. It's going to be difficult for them. And if it gets more progressive or if it gets worse, when it starts having contribution to their motor skills, then they're going to have difficulties just doing clothing, like putting clothes on. It's going to be difficult, or grabbing objects or gripping objects. It's going to be difficult for the patients. So these will be more towards the clinical presentations of the patient. Now, physical therapy approaches to osteoarthritis. The most important thing for physical therapy helping osteoarthritic patients are the day of assessment, the day that you actually see the patients for first time. You need to take great medical history from the patients to understand the symptoms and functional limitations. Therefore, you can design a better plan of care specific to that patient. We all know that osteoarthritis has common symptoms, but functional limitations with those patients might differ. As part of your assessments with the patients, you need to include range of motion assessment actively and passively, and muscle testing. Patients with osteoarthritis do have lack of range of motion and do have weakness. So based on your findings in your assessment, you can design a right plan of care to approach the weak muscles and the restricted range of motions with those patients. Pain management is very important with these patients in the early phase when they start physical therapy, meaning that you can utilize your cold pack or hot pack to increase blood flow with the joint, within the joint, or you can decrease inflammation or control pain utilizing your cold methods. Strengthening exercises will improve the muscles around the joint that is affected, so it can actually take off a lot of load that the joint is getting and it be distributed through the muscles that are around that joint. For example, the knee joint can be supported by having a stronger quad and hamstrings muscles and calf muscles to offload the weight bearing joint pressure, basically. And also emphasizing the correct body mechanic when performing activity of daily livings without or minimal compensations will also improve joint stability with those patients. Range of motion exercises such as stretching will increase joint flexibility, so patients will have more motions in their joints that will take off the pressure from the zone that they only have at the moment before they come to physical therapy. And basically gradual progressions to maintain that range of motion is going to be part of your goals of physical therapy. Functional training is very important. It's very important. Don't miss that as part of your plan of care. Usually physical therapy with these patients starts on the table exercises, then we progress more towards functionality, such as going up the stairs, coming down the stairs, performing squatting, performing lunging, side walking, some stuff that you can actually implement through activity of daily livings that the patient's actually doing it at home. I'd like to emphasize a lot on this slide about the importance of cardiovascular exercises to manage osteoarthritis with the patients. Low impact exercises that increases the blood flow in the body, which utilizing cardiovascular exercises can be very beneficial because of several reasons. It can actually promote overall health. It can improve systems in your body, like your heart, your lungs, your blood flow in the body in general, but it also can affect your osteoarthritis, meaning by improving blood circulations in the body, it can help with reducing the inflammations that the joints are having. Therefore, in the long term, it can delay the degenerations that patients will experience. Also, it can help with managing the weight, meaning that if you reduce the extra weight that you're having with your body, can increase joint compression. Therefore, if you lose those extra weights, can take pressures off of those affected joints in your body, which main ones are going to be hip, knee, and ankle. Improving functionality in general, by just be able to do more things throughout the day that can actually boost the attitude or behavior or your overall health. That's another actually importance of utilizing cardiovascular with the patients. And in general, it's just incorporating cardiovascular exercises. It's a great approach to osteoarthritis. Now we're going to talk about what are the cardiovascular options that you can utilize to help patients with osteoarthritis, depending on what setting you're working, or depending if you're educating your patients about activities that they can do to improve their cardiovascular competency. And swimming and water aerobics are always the best, and it's well done, researched on articles that I was reading about. Swimming and water aerobics usually having better outcome for those patients, especially with those patients who have severe osteoarthritis. Whenever you do exercises under the water, it actually reduces the impacts on the joints, and you can actually do more. Surprisingly, the research was talking about doing exercises in the water will actually cause more range of motion with osteoarthritic patients, meaning that they can basically, you're taking the load off of the joints, therefore you can actually do more with those joints under the water. Which swimming involves the full body workout, You can utilize it with the patients. If you have if you're working at the setting that you have a pool that you can do physical therapy with the patients, then I highly suggest that. If not, then you can just give them home exercise program and ask them to get involved with pool activities or sign up for swimming classes and such. Cycling is another one. A stationary or outdoor cycling has low impact on the joints, and it will improve cardiovascular overall in your body. But finding the correct resistance and duration is going to be the job of the physical therapist as helping the patients. Too much resistance and too long of a duration can have negative impact into osteoarthritis. Rowing is another low impact on the joint exercise that you can utilize it as a full body workout to improve cardiovascular. But it's very essential for the doctor, for the physical therapist to look at the correct technique and proper body mechanic when they're actually performing those type of activities. Elliptical, it's another one, but I'm going to talk about this a little more closely with the patients. Majority of the physical therapy offices, they do have ellipticals that you can actually utilize that with your patients. However, on some of the severe cases, due to limitations of mobility, patients cannot do ellipticals. So I suggest cycling for those patients. Therefore, you can just adjust the height of the seat, so therefore they can maybe only bend their knee to about 70 degrees versus 90 degrees, or 30 degrees versus 70 degrees. So you have more room for situating your patients better on the cycling than elliptical. But if your patient is at the earliest stage or even the moderated stage of osteoarthritis, then elliptical is highly suggested because it can actually impact the joints a lot, and give it a lot of good benefits to it. A duration and frequency of those activities, at least 150 minutes of moderate intensity of aerobic exercises per week. Meaning that you can do 30 minutes for 5 days a week. That gives you 150 minutes of exercising. But it's also suggested that you try to do different type of activities and distribute that exercises throughout the week, and make sure you get enough rest so you can actually do more. And this very interesting research, I found that recommendation of physical therapy exercises to bypass early operations or pain injections. It was eye-opening to see that in Europe they use a lot of physical therapy to prevent osteoarthritis or delaying it. There is no cure for osteoarthritis, but we can actually delay an unnecessary operations or unnecessary injections with those patients. But in the United States, the common therapy for osteoarthritis is pain management injections and osteoarthritis joint replacement. Because of osteoarthritic joints, they use a lot of joint replacements in the United States. But in Europe, it was saying that they try to delay it as much as possible while managing it with physical therapy. I found another research which was done in 2022. It was stating that the importance of physical therapy and the benefits of physical therapy to improving the main risk factors of OA. Let me explain that a little bit for you guys. It's just one of the main risk factors for OA is compression fractures, meaning that when you have bone on bone, when you have that crepitus sound, meaning there's no more cartilage left between your knees, between your hip capsules, and between your ankle joint, then you have a higher chance to get compression fractures and more severe pain. So they did the research. It was based on 8 weeks of treatment with osteoarthritic patients, and they saw minimizing of pain and also crepitus sound with those patients who actually had walked about 15 meters per minute for 30 minutes a day for 5 days in 8 weeks period. And they saw a lot of basically improvement of symptoms, and also kind of like decreasing the crepitus sound as patients were ambulating throughout the gait. In this table, there are recommendations for a strengthening of the lower extremity muscles with osteoarthritis patients. It's important for you guys to implement a warm up and cool down. It's suggested that patients require to about 8 to 10 minutes of warm up and cool down on your therapy sessions. Usually, physical therapy sessions are anywhere from 45 minutes to an hour. So, utilizing about 15 to 20 minutes of warm up, it's going to be beneficial for those patients to have that blood flow in the body before you activate any muscles. A strengthening program goes along with isometric, concentric, and eccentric control muscles, which is suggested to start with isometric and concentric in the early phase of treatment and slowly transition to eccentric control before you discharge the patients. With level 1 activations are usually minimal. It's usually done in the first week of treatments, which it requires knee extension and knee flexion, seated hip abduction, 2-inch step-ups, and bilateral calf raises. This will involve the whole lower extremity muscles, but in very kind of like a mild activation manner. As you step to level 2, which is you can start in the second week of your treatment, you can start introducing patients to mini squat or against the wall, supported squat. You can do a standing hip abduction. You can do standing hip extensions, 4-inch step-ups, and bilateral step calf raises. Then we're going to shift to level 3, level 4, and level 5 when this is usually implemented when you're 100% sure that patients are correctly performing level 2 exercises without compensations and show competency for be transformed to level 3, which level 3 is, starts with sit to stand. It's more like a weight bearing involvement of activities. As you can see, you can perform more higher level of exercises such as deadlift, dumbbell swings, and then the step up's going to be increased to 6 inches, 8 inches, or 10 inches. It's very crucial to do cool downs after your activities. This will allow the muscles to relax. The blood rejection from the muscle is going to get slowly out, and that will actually help with the fatigue they might experience afterwards, after those exercises. In conclusion, physical therapy plays a crucial role in comprehensive management of osteoarthritis, meaning that you have to target a few things. You just don't target mobilization. You just don't target strengthening. You just don't target cardiovascular. You need to implement all those approaches to the physical therapy to help the patients. At the end, this combinations of therapy will offer a patient to have less joint effusion and improve their overall quality of life, which it's going to help them to control their degenerations. With osteoarthritis, I want you guys to understand that we are managing symptoms. We are preventing. We are not curing anything. Majority of the informations of this podcast was gathered from these two articles. They're pretty informative. It's coming from a great publisher, and I really suggest for you guys to read it and enhance your learning about osteoarthritis. I would say it's one of those diseases that might be contributing to your patient's symptoms. As you're treating, patients might have a trauma and coming for a neck complaint, but they also have osteoarthritis, which might limit your therapy. But understanding osteoarthritis, understanding the physical therapy approach can help you to design better plan of care for the patients. Hopefully you guys like this first podcast of mine in YouTube channel. I like you to subscribe my page and write down comments underneath here. Let's have discussions. I love to have discussions with you guys. If you are experiencing osteoarthritis, what are your symptoms? If you are treating osteoarthritis, what's your approach? What are you doing? What's been helping? What's not been helping? Have a great day, and let's educate each other. That's my goal. Have a good one.